Good morning, everybody. Welcome to this panel as part of Research Week 2024. My name is Professor Owen Devereux, and I'm delighted today to introduce our panel. And in setting up the panel, I deliberately wanted to mix academic research at the University of Limerick across the social sciences and health sciences with the perspectives and experiences of practitioners on the ground in the area of food poverty in Ireland. So I'm delighted to welcome our panel, and I want to welcome in particular our practitioners who have visited us here this morning at UL. Yvonne Fleming, who is the Senior Manager for Community Services at CrossCare Ireland. Lorraine O'Connor, who is the Chairperson of the Muslim Sisters of Éire. And then my UL colleagues, Dr. Anne Griffin, Associate Professor and Course Director in the MSc Human Nutrition and Dietetics at UL. My colleague, Dr. Martin J. Power, who's an Associate Professor in the Department of Sociology. My colleague, Dr. Amy Healy, who's an Assistant Professor also in Sociology. And then Dr. Maya Ryan, who currently is in the KBS, but she's really from the Department of Sociology, certainly from that school. And Maya, Martin, and myself have been working on this area. So the format of today, we're going to begin by hearing from Amy Healy on what food poverty is and who is most impacted by food poverty. And Amy then will be followed by Anne Griffin, who will talk about the nutritional aspects and impacts of food poverty. And then we'll hear from both Yvonne and Lorraine in terms of the delivery of services on the ground in Dublin and elsewhere. And then the conversation will shift towards the kinds of actions that we can take around food poverty. And Maya and Martin will speak to some research that we've undertaken in Limerick City for Midwest Simon on the idea of a social supermarket or social grocery. But we'll fan out from that to have a wider discussion on the actions that might be taken to eradicate food poverty. And indeed, ultimately, I suppose we will talk about poverty and not just food poverty. So we'll begin this morning with my colleague, Dr. Amy Healy, who will talk briefly about what food poverty is. Thank you, Amy.
Thank you, Owen. Hello, everyone. So I've got a lot of information on a few slides, and I've been told I should try to move through. But I suppose what I'm going to focus on today is how Ireland, the government, tracks food poverty, specifically the Department of Social Protection. So I'll talk about how we define it. I would say officially, but there's no official measure of food poverty in Ireland. I'll talk about who's included in that measure, who's missing, and how this impacts our understanding of food poverty. And as Owen said, we will be talking about suggestions. I'll have a few of my own. And this really continues research I started many years ago. Sadly, none of the suggestions I made then have had any impact, but we'll talk about that as well. So when we think of food poverty, it's a multifaceted concept. There's lots of different things that go into food poverty. So it can be about having enough food, about having culturally acceptable food, being able to participate socially with food, and simple things like accessing food and even the ability to serve and make food and store food. So as I said, there's no official measure. Some researchers in the ESRI decided to use some data that we already collect in Ireland for the survey of income and living conditions, and just use data that already exists. So we don't have anything that's actually been formally designed to track food poverty. Instead, we're working with an existing household level survey, and I think that's important to remember. The survey data that we're using to track food poverty only looks at households in Ireland. So in terms of my definition, I gave you an idea of what we could include when we define food poverty. The Department of Social Protection really only looks at hunger. So their definition is the inability to have an adequate and nutritious diet due to issues of affordability and access. So that's really just about having enough food. I suggest that, as I said before, there are other things we need to think of, and even Safe Foods has an alternative definition, so that's also the Government of Ireland, and looks at things like social and cultural participatory impact of food poverty, suggesting that when we look at a healthy food basket, we have to also consider those factors when we think about whether or not somebody actually has a normal food diet. So these are the indicators that are tracked by the Department of Social Protection. So there are 4 food-related indicators on the survey. And interestingly enough, the Department of Social Protection doesn't track all of them. So they only track the bottom 3. The bottom one, inability to afford a meal without meat or vegetarian equivalent every second day. The inability to afford a weekly roast dinner or equivalent, which is supposed to be a cultural, the culture of food for Ireland, I guess, is that we all have a weekly roast, which I would suggest is slightly problematic. It's a strange measure, and if you look at the household budget survey, only about 5% of the average weekly spend in the average Irish food budget would be anything like that. So I'm including turkey, chicken, roast, any type of roast meat you can imagine. And then the final one is missing one substantial meal in the last fortnight. So that's probably closer to what we actually think of as hunger. But strangely, the other 2 really are very much about protein. So there's a focus on protein and hunger. I also track another indicator that is gathered in the silk. And actually the people who decided how to build this indicator talked about the importance of social, being able to use food in a social way. So the inability to afford to have a family or friends for a drink or meal once a month. As you can see, that one's slightly higher. But the Department of Social Protection, they don't track that. Neither does the ESRI. Because I think just because it makes it too high, the percentage of people who experience these things, I suppose that makes me sound a bit, I don't know, suspicious. But even if you look specifically at 2020, that's when COVID hit. So that indicator that talks about people missing one substantial meal took a bit of a rise during that period and then settled down once some income supports came in. But I suppose something else to notice or to know is that the way we collected the data totally changed in that time period. So the manner in which the data was collected is different now. It went from being in person to telephone. And the CSO has also warned that the way people answered questions changed during that time period. So my indicator, I'll call it, the one about being able to invite people over for drinks or a meal, took a 3% hit. And as the CSO said, it didn't go down necessarily because people's ability to afford to entertain with food changed. It's just because people were interpreting the questions differently because of COVID. So I would suggest we can't really compare anything before 2020 to after. However, the Department of Social Protection still does. So even though we know that some of these variables went down during COVID, even though I'm going to suggest that most of our panel will say that probably food poverty is going up, the indicators that we're looking at for the Government of Ireland are saying that food poverty is going down. So roughly, if we look at the DSP's figures, so if it's any one of those, so if anyone experiences any of the 3 bottom indicators, so inability to afford a weekly roast, inability to afford a meal with meat or vegetarian equivalent, or missing a substantial meal. So if somebody has any one of those on the survey, they're classified as food poor. I suppose the highest it's ever been is 2014 at around 13%. Sorry, you can't see that there. The lowest was 2018 at 7%. Currently, according to their indicators, about 9% of Ireland is experiencing food poverty. So I suggest it hovers somewhere around 10%. If you include my indicator, it goes a little higher at about 15%. So what kind of people are at risk? I mean, that's another important thing. Again, you have to remember this is all household data. So it's really just people living in households. For those suffering what the Department of Social Protection defines as food poverty, we're looking at young people, definitely relative to the older ones. So under 35s are more at risk than any of the older age groups. Those who are divorced, anybody who's less than being in good health, divorced families, single parent households, those living in consistent poverty, and renting, which I suppose is not that surprising. If we also include a social dimension, we're also then looking at the working poor, so people who are working in elementary occupations, service occupations, manufacturing, and really all households with children. So what does that mean? I mean, I think we don't track that one, but if you can't entertain with food, and it's all households with children, that means there's a lot less birthday parties going on around Ireland right now. So I suppose I'm going to ask, is this really a comprehensive measure? And I know our panel members are going to present some different survey data, some different types of data that will give us a more complete picture of what's going on. I would suggest we could ask a lot more questions. Certainly Bernardo's does, and I won't get into that because Anne's going to. But also we don't collect anything that's comparable to any other country across Europe. I think there is one silk variable, being able to afford a meal with meat, that is tracked across Europe. It's not really a great indicator of food poverty. So we're not using any type of a measure that would allow us to track our progress relative to our neighbors in Europe or abroad. I just am throwing this one out. There's a measure, the Household Food Security Scale module. It was designed by the United States. It's been used in the USA, the UK, Denmark, Australia, Canada, Indonesia, Lebanon, France, as a possibility. There are many others. It asks more questions, specifically about hunger. I didn't have enough money to get more food. We couldn't afford balanced meals. Adults in the household are reducing how much they're eating to feed children. Did anyone in the household feel that they ate less because they couldn't afford? They couldn't afford to feel like they could get full. And were ever hungry. So kind of more specific, and then it would be comparable. So that's one thing. We could be asking more questions. But I think an even more significant question is, what about all the other vulnerable populations in Ireland? Because I would suggest everyone who doesn't live in a household is in danger of food poverty. So if we think about the homeless, we're going to be talking about the homeless, travelers, asylum seekers, those in direct provision. And that, as we know now, overlaps with the homeless. We have many people living in tents. I think the last figure was almost 2,000. I would suggest all those people are experiencing food poverty. They don't show up in what we track at all in Ireland. They're a missing group. And we know that certainly homeless people, asylum seekers, those populations are growing. Travelers, Pavy Point has suggested a lot of travelers are living in poverty. We know that some halting sites don't even have regular access to fresh water within caravans. So certainly when we're talking about making food, storing food, there's huge numbers who are missing. So I suppose we could conclude with a lot of confidence the Department of Social Protection statistics on prevalence are definitely underestimating food poverty in Ireland. I mean, one of my suggestions is we really need to focus on these groups and find out what their experiences are. We know that there are families living in hotel rooms. We know that kids are growing up eating takeaways and whatever their parents can zap in a microwave. I'll let the other panelists talk about their experiences of working with the homeless. But certainly, at the moment, in terms of government figures, we really don't have a clue what's going on. So with that happy note, I shall hand it over to the other members of the panel.
Amy.
Thank you.
So, thank you, Amy, for that very good introduction there. And as many of my students will often remember me saying, the state and the role of the state in terms of responding to poverty, or indeed the role of the state in creating poverty and poverty traps, is of significance. So while Department of Social Protection may be gathering data in one way, other arms of the state, particularly around housing, around, let's say, the failure to introduce a living wage, for example, there are lots of other factors that are impacting on whether people experience food poverty or not. So thanks for that really wonderful introduction, Amy. So now Anne Griffin will talk about the nutritional dimensions to food poverty. Thanks, Anne.
Hi everyone, and thank you very much for coming along today. Other direction. Okay. So thank you, Amy. You really outlined, what food poverty is and how inadequately it is measured at the moment. And when we talk about food security in dietetics, we also talk about nutrition security, because you can give food, but if the food doesn't provide all the nutrition a person needs, then we are putting people at risk for their health and well-being. So when we look at nutritional implications of food security, we can categorise it, to how it impacts on adults and how it impacts on children and adolescents. On the left of this slide, you'll see a scale of food security categorisation. You can see with high food security, what we have is a reliable access to affordable, nutritious food. And this means that food resources are available and they can be implemented in a preventative way to protect people's health, and or they can be used therapeutically either if a person is living with a chronic disease. And then at the bottom of the scale, we see very low food security, where there's reports of disrupted eating patterns and reduced food intake by one or more household members. And this can result in a physical hunger or weight loss due to a lack of food. And there's the in-between then as well. And I think this is important to realise with food or nutrition security. It is something that can fluctuate over time. And as you talked about, Amy, about different scales, one of the scales in the US, what they're looking at, it is limited also in its approach to measuring food security. For example, the resilience within a household needs to be acknowledged as well, because as we know, over the last period of time, different households are experiencing different impacts on their family income. They can recover from this or they may not, and they have to make decisions about, well, how are they going to spend their money? Is it going to be on fuel and heating to the household, and what has to go then? And ultimately, it tends to be the food that is the most flexible in terms of the spending within that household. In terms of nutritional implications, what does this mean? Well, for adults, we see anemia as a result of low iron. So where in the material deprivation, where they're looking at, the roast meal, meat is one of the main sources of iron in the diet, or the vegetarian alternatives. And if you can't afford those, then this is going to be the impact that we see straight away, is anemia. There's also calcium and phosphate can be missing from the diet if they can't afford milk, for example. And then this leads to general poor health, okay? And we can't underestimate the impact of that on a person's lifestyle either. Poor health and being able to do what they need to do during the day, and how that leads on to mental and psychological stress as well. And then, of course, it's the development of chronic diseases that people will end up living with for a long time, like type 2 diabetes and hypertension. We also see high rates of obesity in people who have a lower economic status. And it's important to realise that often living with a bigger body is masking the food deprivation that is happening and the food poverty that a person is living with. And we talk about in dietetics the double burden of disease, of obesity, because it is masking a malnutrition. So somebody will be living with a bigger body, but also experiencing anemia and problems with their bone density, the same as somebody who is obviously underweight. Children and adolescents then, again, iron deficiency is chronic among people living with food poverty. This impairs then their motor skill, their language and cognitive development, socio-emotional state, attentiveness, and ultimately their school performance. So from the very get-go, they're at a disadvantage in terms of education. And of course, we know the social determinants of health and how they impact on a person's health and well-being. So if they're not having good support in terms of their nutritional health, in school, that's impacting then also on their ability to be able to learn and understand and participate in school. It's going to have lifelong implications. There's also greater odds of a child living with food poverty, of having hospitalisation, again living with obesity and future chronic disease development. And we also know that women who are living in food poverty, who become pregnant and have poor nutritional status, that's going to affect the fetus as it's growing inside her womb and puts that fetus at, again, increased risk of living with chronic disease. So what about in Ireland, who is at risk? You might be aware already of the Bernardo's report that was released just recently. And again, they updated this report from figures they collected in January 2022 and October 2022. And you can see again a little bit of this resilience that's going on within households in trying to adapt to food poverty. For example, parents skipping meals or reducing their own portion sizes in order to be able to provide their children with food has increased to 41% of parents who took place in this survey from 29% over the space of a year. They felt they had not enough food to feed their children. Latest figures are at 26%. So that's 1 in 4 parents who were surveyed. Regularly unable to afford meat or vegetarian meal as often as they would like, at 18%. Having to borrow money to feed their children, it's at 24%. Or using a food bank, again, is increasing. You can see over a year and a half, from January 2022 to November 23, from 3% to 12%. Okay, and these are stark figures. Amy mentioned the Safe Food surveys as well. So what Safe Food do is they look at the cost of a healthy food basket. So they ask families, you know, to tell them what are the foods they are eating, because an important part of food and the food that we eat, as you all know, is its acceptability. Okay, there's no point telling people to eat foods that they don't feel are acceptable either to their culture or to the family's likes or dislikes. Because one thing I can assure you is people who are living in food poverty do not have food waste. Okay, they're trying to avoid that. What Safe Food have looked at is the cost of the healthy food basket, and they have found that the staple foods, not meat, but milk, bread and cheese, the cost of these have increased from 16 to 25% over the space of the last 12 months. So that's inflation on food. So that's a significant, that works out as €1,200 to the cost of a family budget every year. In Limerick, the regional population profile health from Midwest Health Region have looked at the deprivation scores across the Midwest. And you can see at the very top there, just look at the colours, that's the national. So if it's orange, dark orange, red, that's indicating extremely disadvantaged, very disadvantaged and disadvantaged. And hopefully my little marker, you can see South Limerick City and North Limerick City and the level of deprivation that exists in the Midwest at the moment. So again, we need to know where our populations live as well, who are living with deprivation, and this is where we need to start thinking about targeted interventions. But there's no such thing as one fits all. Okay. So there's a number of actions that are needed, and I think these kind of piggyback on what Amy was saying, and I hope align with what the rest of the panel also agree. We need to create awareness about the existence and severity of food and nutrition insecurity in Ireland, and especially in our own local communities. And in doing that, we can advocate then for comprehensive, robust data on determinants and prevalence and better understand, because as we said, the measures we have at the moment are crude. They tell us nothing about the stories, the resilience, the availability, the acceptability, the affordability. With the communities, if you look in greater detail at the Public report of areas of deprivation in Limerick, you will see that there are areas of high deprivation right next to areas of affluence. And so it's masking again a lot of what is going on within households. We need to partner with diverse stakeholders, social assistance providers, local authorities and non-governmental organisations, so that we can be comprehensive, intersectoral and integrate in our approaches to trying to tackle with the food poverty that we can recognise. And then to participate in the development of political instruments and interventions to ensure equitable access to high quality safe food. So again, it's not this idea that, you know, one approach will fit every community. We need to understand our communities and understand what are the barriers and what are the assets also within these communities around supporting a better food security for them. I'm delighted to be a member of the steering group of the Limerick Food Partnership, which is a collaboration of government organisations, local community organisations, and individuals across Limerick City and County, and we are pitching actually on Thursday to fund the Food Finder, and this is a project that we have developed towards developing a food poverty strategy for Limerick, and this food poverty strategy will be informed by engaging with local communities to better map the food environment within Limerick City and County so that we have a better understanding of the stories that and the resilience that people are living with to try and survive food poverty. So I'm happy to talk about that a little bit more afterwards.
Thank you, Anne. Thank you so much. I was struck there, Anne, by the reference you made to the sacrifices that parents regularly make in terms of providing nutritious food for their children. And this, comes the work we did on the idea of a social grocery, a social supermarket. The fieldwork we did for Midwest Simon, again, would confirm that. And it runs against that narrative that the poor are to blame and, they have PlayStations and they can afford this and they can afford that. There's a lot of stigmatizing discourses out there about food poverty and shaming and blaming people who live in food poverty. So I'd like now to turn to Yvonne and to Lorraine to maybe talk about their activities on the ground. So Crosscare have had a long history in Ireland in terms of responding to food poverty and poverty more generally. And of course, the Muslim Sisters of ERA have been very active in Dublin with a run around the GPO, and recently have announced a group in Limerick City. I think we're joined by some of your colleagues this morning, Lorraine. So we might start with yourself, Yvonne, and the work of Crosscare, and what are the big issues that you see? You can sit or stand, whatever you like. You stand, okay.
Okay, so thank you for the invitation. Yvonne Fleming is my name. I've been working in Crosscare for over 20 years. Crosscare is the social services of the Catholic Archdiocese of Dublin. It's around since 1941. Now it's a huge organisation, 500 staff. Our biggest areas of work are in the areas of homelessness and youth work, but we've smaller initiatives in the areas of migration, homeless prevention and food poverty. Originally, back in 1941, the work started out as penny dinners type setups in post-war Dublin, and developed over the years. So specifically in the areas of food poverty, we went from those penny dinners in the 1940s to in the 1980s, we set up this huge food bank when all the talk was about diverting food from landfill for the poor. We got into that. And then prior to COVID, we had food banks, small local food banks in different parts of Dublin. And then since COVID, we reviewed all our food poverty work. And we found that as an organisation with values of love, respect and excellence, and in the context of how the thinking was going on food banks, that we needed to make some changes. So it occurred to us that these local food banks, where people queued up in public and got a parcel of food every week, that wasn't respectful, or it wasn't excellent, and it wasn't in line with the thinking of countries like UK or Canada that were moving away from food banks. And there was this discussion about the normalisation of food banks wasn't a positive thing, that we've a mature welfare state that shouldn't need them, and that this argument that diverting food from landfill and giving it to the poor, that was a flawed thinking. And why should people in difficulty eat food that was diverted from landfill, and that there was more fundamental problems. These food banks were a sticking plaster over more fundamental problems in our welfare state. So we developed a new model. We shut down the local food banks, and we developed a new model which has three parts to it. The first part is people come, they self-refer. There's one phone number which we publicise. It's explained to them that this isn't like a food bank, but you come, you get your free food, and you engage with a caseworker. So it's done by appointment, it's discreet, but it has an end point, not a set period of time, but the engagement will come to an end at some point. And what we offer through the casework is we examine what has brought you here today. So is it high rent? Is it high debt? Is it low-paid precarious labour and very high rent? Is there something else going on in the family? And we work case by case with people. So some people come to us, they're with us for 4 weeks. They get their free food, they work with a caseworker, they restructure maybe some big debt they have with us, and then they say, you know what, I think I'm okay now, I can manage. Other people are with us for a very long time. There isn't a set time, but what's different is the food is free and it's discreet, there are no queues, but it's that they have to stay engaged with the caseworker during the time and be progressing towards a point where they're going into a shop with their own money and buying their own food, like I do, like we do, and that's what we want for everybody. So one of the things we did in this change is we went to Minister Joe O'Brien in the Department of Social Protection, and he's the junior minister. And we explained what we were doing, and we got him to develop a pilot. I'm not sure if there's anyone here from Midwest. Simon, is there? No, they're involved in the pilot with us. But the minister devised a pilot based on this food poverty casework model. We pitched to become the Dublin partner of the pilot. So there's the Simon in Limerick, a group in Cork, and us, for 18 months piloting this model. So what we've got is that statutory funding for this pilot, through which we report back to the department what the drivers are into food poverty, and we report back on our stats. And so in this way, we feel that the department getting involved in this different kind of less charity-based solution is actually progress. The drivers that we are seeing into food poverty match the issues brought up by the Bernardo's research and Trussell Trust research. So Trussell Trust, to be familiar with, they're in UK and Northern Ireland doing this kind of work. Long-time food bank operatives moving away from food banking. So the issues that all of us are seeing is, in summary, that social welfare payments are not in line with inflation and they're hard to access. So if you're not first language English and if you're not digitally literate, they are barriers to getting what you are entitled to, and they're not in line with inflation. We met with Leo Varadkar when he was the Taoiseach just before Christmas, and we raised this point, just, you know, child benefit, for anyone who gets it, I do, is 140 euros. But a few years ago, it was over 160. So since austerity payments not all payments have increased. The other driver we're seeing is low-paid precarious employment and very high private rental accommodation. And so the fit isn't there. So people pay the rent first, they pay the electricity bill second, and then there's nothing left for food. So it isn't actually food poverty, it's poverty in general. And then the third point, we see sometimes people do need help with budgeting, meal planning, but also things like having the confidence to ring an energy provider and say, I want to talk to you about a better package. And we will sit with the person, coach them on the conversation, role play the conversation, put the phone on speaker, and the person will have that interaction with the energy provider. And not only change the package for now, but have the confidence to do that with other providers, where it's never occurred to them to make that change. If they've a complex debt situation, we might link with MABs. So not only are they getting their free food now, engaging with the caseworker of cross care, but we're giving them skills and links and connections for the future. So when this matter arises again, they can come back to us, or they know about MABs, they're comfortable going there, or they're comfortable making a phone call to a provider. We have constraints in the form of We have some statutory funding through the Department of Social Protection, but it's for 18 months. We hope it will continue after that. We have some grants like the Late Late Toy Show, but it's all annual, and we have some fundraised funds. But we do find that sometimes people who give to in relation to fundraise funds and in relation to the media, what we find sometimes is they want a queue. They want somebody in absolute hardship. They want a photograph of an empty press, and we won't provide that. So because what we're doing is subtle, under the radar, sometimes the media, it's not attractive to the media. We are engaged, I was talking to Owen, with a piece of research that's been led by UCG on representation of food poverty in the media. You will notice in the run up to Christmas, almost every year, there's a photograph of the queue outside the Capuchins in Dublin. That makes my point. So in the last 12 months, up to March 2024, we've dealt with over 900 families and individuals. 4/5 of the people linking with us were women. A quarter were living with a disability. The majority were non-EU, Roma or traveller, which links with some of what's been said here. All were in either social housing, private rented or homeless. So it's matching what we've heard already. And as I said, we can lift the immediate burden through the provision of free food and then address some of the most pressing issues, but send people away with new skills, new connections. And then what we're doing on that macro level is going back to the Department of Social Protection and other relevant departments and saying, these are the drivers, this is what you have to change. But also the other pieces of research are coming out with the same things. And then I just wanted to give a case study, which is an anonymised case study of a woman living in international protection accommodation. So with her payment that comes with that, with her husband and her 3-year-old, and the 3-year-old got a diagnosis of anemia. So then she needed to buy extra fruit, extra iron drops that were costing money, and she ended up coming to us. She had no kitchen in the facility where she was staying, so we were able to link her with services that offer a community kitchen, help her apply for an additional needs payment for her son, tell her about courses, Healthy Food Made Easy, if she wanted to go to them. We got the son into Ozanam House. It's a creche in Dublin. So he was going to preschool there. We linked her with a programme called Work Equal, which helps people with interviews and close to get back into employment and builds women's confidence. And we linked her with our own Crosscare Migrant project on some other migration-related issues. So she's still living in that accommodation, but she has an administration job and the child is in preschool. So while people come to us for food, often the issues we're dealing with are nothing to do with food. So they're about getting into employment, accessing childcare, accessing the payments you are entitled to, but you couldn't navigate them because you're not first language English or because you're not savvy on the computer. So we are hoping that by engaging with Department of Social Protection, pilot of this, that this will become an ongoing funded initiative. And what we're trying to do in Crosscare is tell people about this, so when groups are thinking of setting up a food bank, that they do something less of a charity model and more of a model that will get people out of that need for free food. We've read the research about shame and how queuing up for a food bank is chipping away at people's self-esteem, and we're just trying to do something differently that more matches our ethos of love, respect and excellence. I'm happy to take any questions or chat after the session. Thank you very much.
Thanks, Yvonne. It's interesting to hear about the sort of shift away from the charity model in terms of food poverty, and maybe not for now, but I think there. I know you mentioned. I haven't heard it called UCG in a long time, since I was there a million years ago, but it strikes me that the university sector, this university and the other universities, I think there could be much more significant engagement between NGOs and the university sector in terms of research, in terms of how these new models are working or not working, and that's something we can talk further on. So. And I want to turn to Lorraine, who's going to talk about the work of the Muslim Sisters of ERA. Lorraine.
Can we stand up?
You can sit down or stand up, whatever you like. What are you comfortable with?
No, I don't know if I'm okay.
Martin Power is our radical here, so he's staying seated, so you may stay seated too.
So, okay. Yeah. So, good morning, everybody. So, what an amazing speakers, the three of you, but I'm going to come with a bit of doom. Okay, I'm going to come with what I see every Friday night. I'm going to come with, and I'm not saying your talks are not reality. They're absolutely fantastic. But I think there's a huge disconnect as well in what we're seeing for the past 8 years on working outside the GPO. People always ask me, who do you feed outside the GPO? Who are the service users? What type of service users are there? Before COVID, I used to say there was 3 categories of homelessness. There was families in hotel accommodation. There were single people, male or female, in hostels, and there were rough sleepers. And that was it. That's gone. Now we have families who have homes and can't keep food on the table. We have families in direct provision centres. We have families in hotel accommodation. We have families in centres from IPAS. We have a migrant problem. We have people sleeping on tents. We have rough sleepers. We have, I'm sure you all know about what's happening outside the IPO. We have males sleeping outside on streets with no toilet facilities and so forth and so on. We have seen a huge increase of food poverty. But as I spoke earlier to my colleague here, Yvonne, it's not just food poverty, it's poverty. It's poverty on a whole. How do we alleviate this? I don't know, because it's growing rapidly. And in your statistics earlier, there's a huge disconnect there for the findings from the Department of Social Protection that they're not seeing. Many times over the past 8 years, I've challenged our government. I've challenged Leo Varadkar. I've said to Michael Martin, come down and speak to your people. Come down to speak to these people who are queuing up, who want support from food banks and from food soup runs. Prior to Christmas there, we had the charity regulator coming down and the HSC on many of the soup runs up in Dublin, shutting them down. And they are some of the restrictions that we had to deal with. Thank God Muslim Sisters of ERA is in a position that we are a registered HSC soup run and we are a registered charity. So we're okay. I do understand the HSC, because linking into diet then, there has to be an element of the food that's given is substantial food for people. We focus as Muslim Sisters of ERA on hot meals, and then after the hot meals, as I spoke to Owen earlier, we've got 6 6-foot tables. So you can imagine the length of that. And our main focus is on nutrition. We do have a table down the end, and I think we'd be shut down by our service users if we didn't have a goodie table, a bit of chocolate or biscuits on the end, because they all look for that. And we do have people with diabetes as well who do look for a sugar. You know, we have glucose tablets and so forth and so on for them. So prior to the hot meals, you have a full length of fruit, yogurts, cheese, sandwiches made up of whole grain. Our rice, we try to deal on our rice. Most times I ask for brown rice, brown pasta, fresh vegetables. All our food, we do not do a food kitchen. We have one food kitchen, down at Balbriggan, where the sisters cook there, and that's with the HSC monitored. And the rest of the food that comes to us, the 500 meals, comes from restaurants. So we have a link in with the restaurants in Dublin where we know the standard of food has to be a high quality because it's coming from a restaurant that is a public, it has to serve food to the public. So making sure that the food is substantial for the people down there is our main priority. But in that line of queue, and it breaks my heart because you mentioned the penny dinners earlier, and I mean, I'm not going to say how old I am. We'll keep that a secret on, yeah. But I remember being brought up by my mother talking in the 1950s that she had to queue at the penny dinners, that things were really bad then, and that she used to queue there for food for her and my father. And I stand outside the GPO every Friday night, and it breaks my heart to know that was 60 years ago. Look at us today, 60 or 70 years ago. Look at us today. Are we any better? Because the food poverty is rising, and it's rising rapidly. And I think there's a huge disconnect with our government. I do not think our government are seeing what is happening on grassroots level and what is happening with the people. In terms of, I think the hardest thing that I've ever seen is recently is outside the IPO centre, where I went down recently and I seen a chap eating on a Tesco's bag, tore in half, a yoghurt, an orange and a brioche roll. And he was sitting just there. I had to look and say, is this Ireland? Is this the back of Grafton Street? And that's what he was eating. And to me, I'm looking at what is going on, what literally is going on in our Ireland. We're one of the richest countries, so they say, in the world. They say there should never be food poverty in Ireland, and there is food poverty. I have men coming down on Friday nights, coming from work, for their dinner, and for a packed lunch for the next day. And I know say it's Saturday. A lot of these guys are on building and do overtime because they can't pay rent for their families. Their rent is colossal. A one-bedroom apartment, and I know this myself because my two daughters are living in one-bedroom apartment in Dublin, is €2,000 a month. One bedroom. How are you supposed to feed yourself if you're a single person? The HAP is a joke because, it's a complete joke. That's another topic we'll go into, because people cannot get accommodation on the HAP scheme, because if you go over a certain criteria, you're not going to be able to feed yourself, but yet there's no accommodation that meet that criteria. They're sky high, rocketing sky high. So it's a big whirlwind. I always look at the metaphor of a fishbowl with a load of fishes in it going around in a circle, and that represents each person. We have a huge migration problem. We have a huge homeless problem. We have a huge housing crisis problem. We have a huge poverty problem. Where do we go from here? 8 years, and I mean it from the bottom of my heart, I wish we didn't have to be out there, but we do. And after 8 years, it's really sad. So I'm so sorry coming with that black cloud right now, but that's the reality of it. So,
thanks, Lorraine. Has your organisation, have you had to deal with racism, anti-Islamic sentiment and so on in the work that you're doing?
Yeah, we do deal with that. But look, you know what? We got to keep going. If you start letting, it is a little bit nervous right now that the far right are coming. They're getting that bit stronger. I was speaking earlier that I'm originally from Coolock, which is a heavy part of the north side of Dublin. And there's a new organisation out called Coolock Says No. And I was looking on TikTok the other night that they were doing a protest, and they were passing my mother's house where my sister lives. And I will face anyone. I'm a strong person, but I'm reluctant to go to visit my sister right now because I'm a visibly failed woman. They won't see a girl from Coolock, they'll see a migrant. So yes, and I've got 3 daughters who are visibly failed at the moment, and we're warning them, even though they're all married, don't go into the city centre if you don't need to, and that's not right.
Thanks, Lorraine. Martin and Maya, will you talk to the work that we undertook in Limerick for Midwest Simon on the idea of a social grocery? And then when we've heard Maya and Martin, then we'll turn to the floor in terms of questions that you might have for our panellists. We have some issues to chat through with you. Thank you. Maya.
Thanks very much, everyone, and thank you for attending. So I will first speak to you a little bit about the existing mechanisms helping to alleviate food insecurity. And I suppose I will echo a lot of what has been said already, but this is essentially based on the research that we've done early 2020, and that research was commissioned by Midwest Simon Community. And it's supposed to be a feasibility study around potentially opening a first social grocery store or social supermarket, as they're known abroad, in Ireland or in the Republic. So we've asked quite a lot of questions just to establish where people are as well in terms of their experiences of food insecurity, and ask them effectively, would they welcome this type of store, discount food store in Limerick City. So the research, I will talk a little bit more about the research in a minute, and you can scan the code if you'd like to read the report. But effectively, for those of you who don't know Midwest Simon, so this is a charity that, in addition to other services, offers a bi-weekly food bank in Limerick, Clare and Tipperary. And so we've interviewed and conducted a survey as well with people who access food bank in Christchurch, in Limerick. So at the time, in early 2020, there were around 100 people going through the food bank weekly. So altogether, the cohort was around 200 because it's bi-weekly service. So social grocery effectively is a store that offers a wide range of food products, such as, for example, fresh fruit, fresh vegetables, fish, cheese, meat, and so on, in addition to the products offered by a food bank. So the free package from the food bank is still available to those who wish to avail of that. So the idea for Limerick Food Bank was around that kind of model. So registered food bank users, so people that are below a certain income threshold, would also be able to access a social supermarket where they could purchase a kind of discounted fresh food. So in terms of the findings around social grocery from the report, what we found is an overwhelming enthusiasm around this type of store opening in Limerick among the food bank users. However, 4 years later, still we don't have a food bank in Limerick, but there are social supermarket in Limerick, but there are very many social supermarkets. In fact, around 1,000 is estimated across the globe, and they have different forms. They have different structures and models. Most of them, though, are conditional. Okay, there are very few that offer service unconditionally to whomever wants to use it. Like, for example, the social supermarket in Belfast. So I have a quote here that you can see in this slide. And social supermarkets in the north of Ireland have actually been piloted in 2017. So they're there a good while. So as you can see from the slide, the quote states that some of them distribute vouchers rather than actually offering food or operating as a shop, but all offer these wraparound provision and signposting to services such as benefit checks, debt advice, training, employment advice, and childcare. All social supermarkets have eligibility criteria to determine who can access support, and some operate on a referral. They are also residency-based, so there is residency conditionality. So, for example, if you live in Derry, you can't access a Belfast social supermarket. So what we can see here is that while there are certain supports available, the issue is quite individualized, and it is suggested that it can be individually corrected. In general, is a social grocery or social supermarket a good idea? Well, they operate on a different model, and I suppose Yvonne spoke about the similar model, that they are not emergency-based food relief. They are more of a social enterprise, based on social enterprise model, so more holistic and and community-based approach. There are very many benefits, like, for example, we spoke about breaking the stigma, which is associated with using food bank. So some suggest that, yes, social supermarkets actually can break that stigma, at least to a certain degree, as they offer a retail-like experience. They also offer choice in the type of food that people access. They offer varied diet, healthier choices, and they also alleviate that problem, which we spoke about today as well, which suggests that people, the first thing that goes when there are income issues in the household is actually food. So people do everything, they actually prefer to not eat or not buy food and pay the bills, because that's the most important thing. So in terms of other benefits, there are also those associated with food waste. So there are around 57 million tons of food wasted across the EU. So food corporations reduce food waste through such initiatives like food banks and social supermarkets. So these contribute to sustainable food practices and social inclusion. Are there any disadvantages? Well, for the recipient or a client of a social supermarket, the key disadvantages is around a short expiry date of the products that they purchase. So that can impact on food safety and food quality. However, the recent research shows that while the social supermarket offers a retail-like experience, when it is based on conditionality, so someone has to admit that they have problems with income, that they can't access enough income, that they can't purchase the food, it is still stigmatizing, it is still eroding their dignity and diminishing self-esteem. And social supermarkets also do not tackle root causes of poverty. The other thing that we have to consider is that corporations, food corporations, actually benefit from household insecurity. For example, from reduced corporate taxes, avoidance of costly disposal fees, benefiting from food stamps, boosting their public image for their charitable impact on food banks or social supermarkets. But effectively, in their interest, it is to maintain the status quo. Overall, when we think about social supermarkets, I suppose they have capacity to alleviate food insecurity, but only if they are people-centered, community-based, offering dignity, choice, reciprocity, and are based on universal access, and also consider things like nutrition as well, which is really important, that within the social supermarket, there are products that offer a range of nutritious food, not only a food that goes, let's say, didn't go to the landmine. So in our research, we didn't have capacity to test for social supermarket conditions, but we actually looked at the experiences of people who are availing of free food from a food bank, and what type of impact did it have on these participants. So in general, we've actually surveyed 65% of the population of the food bank at the time, and interviewed 15% of the population. Our descriptive data found that majority of survey respondents reported the need to avail of food bank due to low income from work and state benefits, including pension. For a significant proportion of people, the need to use food bank was due to illness, disability, unemployment, high rent, social welfare being refused or cut down, caring for a family member. So we spoke about all of these causes that effectively people experience as part of food insecurity and poverty. In terms of accessing food, 58% of survey participants reported experiencing periodically lack of sufficient access to food, and that's despite having this bi-weekly package from the food bank. Our research shows that despite having that access to non-perishable food package every 2 weeks, people experience hunger, malnutrition, they were unable to feed children, clothe children, pay for medication, pay for heating, bills, travel. There were individuals, there were a few participants who spoke about living in the proximity of 12, 15 kilometers from Limerick City, and they would only be able to get in every second week because the bus was, if they wanted to use public service, there was a bus at 8 o'clock in the morning and the next one was coming back at 8 p.m. So they were effectively just getting a lift twice a week. So for very many, and we spoke about it today, that there are a lot of food bank users were actually workers, full-time workers, homeowners, and for a lot of them, it was the unexpected, often tragic life events that changed their lives from really ordinary life to a different life trajectory that set it on the course for poverty. Like we can see in this quote from one of the participants who stated, "I was working 15 years, my husband was working as well, but last year he got sick, he got brain cancer, so he's not working and I mind him at home. I had to quit my job as well." So things like that can actually change the whole course of your life. And in general, our key argument from these observations or these types of observations was that one of the key drivers of food insecurity in Ireland is that disaggregated nature of Irish social welfare policy, which we spoke about earlier today as well. So thank you very much. I will pass it on to Martin Power now.
Years ago of the ex-leader of the Labour Party, Joan Burton, when she opened a food bank in Cork, I think, if I remember properly, with a big smile on her face, as if opening a food bank is anything to be smiling about. The existence of food banks in the country is an abomination. It is nothing to be proud of. It's a spectacular example of the utter failure of the Irish state. That's exactly what it is. While food banks do fantastic work and are badly needed, that's what they are. They're a visible example of how the Irish state has utterly failed the people. The second thing I want to say is in relation to how food banks and the people who use them are covered in the media, because again the representations of poverty in general and food poverty in particular again tend to follow a kind of a similar path, and then that also then informs the policy response and also how people view those particular issues. I think it was you said at the start there about the government not knowing about, I would tend to disagree and say that they do know, they know exactly what's going on, and that's why they ask those questions in those ways, or not ask other questions. So the information that you have, again as researchers, the information that you have dictates the size of a problem. So if you're not asking the right questions, then the problem isn't that big, which means you don't really need to deal with that problem. And this all comes back to essentially the implementation of a political project, which is neoliberalism, which is about the commodification of absolutely everything, whether that's education, housing, everything, and about the generation of profit from everything. And food banks are no different in that, there is there is corporate involvement in that, through, as Maya was saying, in terms of, the provision of food. Yet on the other hand, you have those contributory multinational corporations, for example, being applauded for the charitable role that they're playing in supporting food banks, but there's very little coverage of the way that they're actually contributing to the expense of the public purse in the limited number of, or the limited amount of corporate taxation they're paying, or the fact that they're paying people poverty wages, which contributes to the people who end up using this. Again, we saw all of this with the complete furore over the pandemic unemployment payment, when people simply refused to go back to jobs that paid them poverty wages. So all of that stuff is left out. We don't discuss any of that. Even in relation to the report that Maya was just talking about that we did in Limerick, it was a really interesting response to the publication of that report, where, again, Maya led on all of that. There's really detailed information provided by the people who use the food bank about why they did that, why they have to use the food bank, and the circumstances that brought them to require that particular service. So when the publication of the report was then followed by local media coverage, because there was two different sets of coverage. One was the national coverage, which was in the Examiner, which was really good, interviewed Maya, said what was in the report. And then we had local media coverage, which was very, very different. So the local media coverage actually focused on things which weren't in the report and attributed why people used food banks to things that just weren't mentioned at all. So there was this narrative that was constructed, which was then run at the time by local politicians, who started talking about, the existence of a social grocery might be good, but we'd really need to be taking account of who would use it, and we'd need to make sure really that people wouldn't be scamming this, right? And again, this all goes back to just the whole process by which, again, we can trace it all back to this person I have a great affinity with, Margaret Thatcher, and her implementation of neoliberal policy in the UK in the 1980s. You have this process which the whole existence of the welfare state has been, questioned and rolled back and constantly chipped away at by politicians in the service of neoliberalism. And here is no different, right? Leo Varadkar's, again, myself and Owen and Maya have written about Leo Varadkar's, welfare cheaters all campaign. Utter nonsense. He knew it was nonsense. Eventually he admitted it was nonsense. But that was all about questioning not just those in receipt of welfare. It was about questioning the whole role of welfare itself. And that process continues with this, which is questioning the people who use food banks. And it's not about the structural causes of poverty or the state's abject failure in dealing with poverty in its entire existence. It's done nothing to deal with poverty in this country. It sets goals which it doesn't meet and then regurgitates the same goals in the next, and it farms everything out to charities. Job done. Right? It's complete abdication of responsibility. But that process is replicated in terms of how food banks are presented to the general public. So there is never a questioning of the structural causes of poverty or food poverty. It is about the construction of people who need to use food banks as some form of individualistic failing. So that's my rant for today.
Thank you, Martin. I was going to say it's not like you at all. It's a case study in terms of how research findings are not disseminated, or when we did disseminate them, what was then selected. And as you say, the report is really so strongly full of mothers and fathers and spouses and partners talking about the sacrifices that they make for each other and particularly for their children, mothers particularly going hungry, not buying a pair of shoes, making sure that their children eat. And it does counter, I said, that kind of narrative of, they have PlayStations and they can afford this, but they can't afford that. I think it's time we turn to the floor in the last 10 or 15 minutes or so of our session. I mean, it's fascinating to hear the overlap between research, academic research, and the experiences of practitioners on the ground. Do you have questions? We have a roving microphone if you would like to ask a question. Anybody? Yeah, at the back there.
Hello, my name is Nilofa. I know Amy was talking all about the groups, who avail the food. The food facilities that you have. My question is, I think from my own experience now, I've been a victim, years ago myself of food poverty. Now I think. You didn't, I don't know, you mentioned or I missed because I came a little bit late, about the main group that actually slips through the net is, I think, the white collar job people, professionals, and I don't know if it's still, it might have actually changed, but there is nothing on the social, the Department of Social Welfare, when you go on job seekers benefits or when you look for job seekers allowance, anywhere to say that if, there is no much awareness to say that you can avail of these food, facilities or whatever you have. I think that's very important, that I know you're all great speakers and, coming from different backgrounds and you have, I think it's high time that you could do something in your power to actually liaise with the Department of Social Welfare and to have something on their website to say, I don't know if that's possible in terms of awareness. Because even recently, I know from my a couple of people, recently I know one person in Dublin who's in his mid-20s, lost his job. And he's actually from the UK, but he doesn't know, how to process this. I was guiding him through the job seekers allowance because he doesn't fit into job seekers benefit because there's only 48, he has to have 48 PRSI contributions. But then living in Dublin, yourself, like Lorraine mentioned, how high the rent prices are. Even for a single room, you pay like about 1,000, and then on top of it, because you only get 800 on job seekers allowance, approximately, I think, something like that. So would you have, like as I said, I'm a physio myself, and I've lost my job, following an accident years ago, and 4 years I was out of job, and then, I was benefiting from an invalidity pension, but then initially 2 years I was out of the country, and then when I came back, I feel very emotional even to say that. When I came back from India, because I didn't have networks, family support here, obviously. So when I came back, I actually found that I had to go through a long process to even avail child benefit, because they said, though I had acquired naturalization at that time, they said, you have to prove your habitual residence, which I did, and blah, blah, blah. But it took, months to actually get into the system. Until then, I was actually suffering. I actually had 1 meal a day, with 2 kids. It was really heartbreaking. It was, you actually juggle with the money that you have, I think a lot of the speakers here, you mentioned, and I suppose the last speaker, you mentioned about the tragic life experience, unexpected things that happen, yes, which is very true. Like as I said, I've been there, done that, so I think it's very important. Yeah. Please.
Thank you so much, sister. I think that's a huge, again, we go back to that disconnect. There's not enough information out there, and especially Muslim Sisters of Era sees this rapidly, has a migrant organisation that's run by migrant women. There isn't enough information of the help, like even with Cross Care. They will come to us looking for food vouchers, food bank support, and so on. And we will do that. We will, give them a kind of a brief help, and then we do referrals on to Cross Care that are a more established organisation, and have that funding and have that backing behind you. But there is, what she is saying is correct. There is that disconnection in information, especially for migrants within the country.
Thank you. Mary? Sorry,
I just wanted to add that we have recognised that within the Limerick Food Partnership, that lack of information. And while we're a load of organisations, we're all working almost in silos. And we need to start sharing that information. So the Food Finder is about trying to map and to provide information that is user-friendly, so that the likes of yourself, that you can just go somewhere and find out, okay, well, what is in my area and what is acceptable to me? And we're trying to do that across every level that we can think of within the environment. And so a key part of our project will be going out and working, engaging, collaborating with local communities to try and better understand what is the information you need, not the information that we need, the information you need.
Thank you so much. When I was a child and I started teaching applied social research here in UL, I had a class which had 3 Marys, and one of the Marys is here. And you have a question, Mary? Indeed.
Over 600 individuals avail of our food bank in a rural area of East Limerick every month. And I'm very interested to hear from Yvonne in Crosscare, and I've heard speakers from the Trussell Trust before. Unintentionally, we fell into the provision really of food, providing food supports in the area. We thought we applied for funding, and we thought we would end up providing food just to a small number of people who we already had connections with, families and individuals. We got a huge amount of food. It grew and grew and grew. Before we knew it, now we're like a major, I would say, food support provider in County Limerick. And we don't really want to be. And as more people come, we're thinking this is getting worse and worse. There are wonderful positive things as well about the provision of the food bank. So we're in a local community. There is a great community ethos. We know most of the people who are coming in by name. The mornings of the food bank, there's banter, there's laughter, so there's really nice connections happening as well. But as with your values, we're around dignity and respect. And when you're giving a bag to somebody, it's very hard to keep that at your core. So we're questioning the work all of the time. And I suppose it's about the resource provision then to move away from it, because a lot of the people who are coming, we got a small amount of money through the toy show that we can network people in with the wrap-up supports we offer in the centre, and people are availing of that. Most of the families we would know. But people aren't coming short-term, and there is the dependence there, and we know they need it, and it's a tangible support we can offer. So we're really grappling with it and how we can move away and how we can give more support to people. But it's something we actually don't want to be doing, and it's a charity model. And we know people have had shame from other charity models in the past. So I'm delighted to hear there's research going on it. We would be interested in participating because, we'd love, and we may have to make the call of closing our food bank because we don't have our own resources to provide it, because it's hugely resource heavy in terms of personnel, and you get no support with that. So I know there's now some funding coming from the Department of Social Protection around people, actual manpower, to give that support to people who are coming. We have a small amount that we can give. So look, I suppose the idea of the social supermarket sounds fantastic. It's the resources, I suppose, and the manpower to keep that going on a long-term way. So yeah, look, really interested to hear from everyone today, and hopefully, what we really want is anti-poverty work. And I would love to close the food bank and put all of the hours we put into the food supports into shouting about anti-poverty and trying to create structural change. So look, we fight the good fight, but yeah, just to say that, thank you.
Thanks, Mary. The work we did on the idea of a social supermarket in Limerick, when we looked at social supermarkets elsewhere, what was really interesting about them was that they were effectively like, in quotes, a normal shop. You had choice, you had dignity there, and the ones that are really effective, for example in Finland, the ones that are most effective have a cafe. They have an element to them where you can have your cup of coffee, but the real reason is actually about availing of advice and supports, and those wraparound supports. Then the research says that if you can also double up by advising people in terms of the needs that they have, their interaction with the Department of Social Protection, for example. So it is a very interesting model. Having said that, I'm still a little bit agnostic in that I think once something becomes visibly known as that's the social supermarket, in my head I'm kind of going, is that just a modern version of the penny dinners, or will people still stigmatise the idea of a social supermarket? So there's a thing the way up there. Interestingly, one of the things Martin talked about, the kind of local response to the idea of a social supermarket, and one of the comments was made about, well, you know, what about, if you like, the ordinary traders, and will they now be impacted negatively by the presence of a social supermarket? Where will it be located? Where will these people be? I mean, recently in Limerick there has been an objection to the St. Vincent de Paul expanding its food bank provision on Heartstone Street, and again, sort of commercial interests, residential interests complaining about that. So it is complicated. Yeah, Amy, please. Yeah.
My other hat is I'm on the board of directors of the Midwest Simon, so we have talked about a lot of these issues. So we have a premises now in Limerick, but it was donated by someone with a lot of money. I don't know if I can say who, but we are doing those things. We're talking about providing services besides food. So there will be a kind of a wraparound service. We had huge issues with a location because of competition. The corporation didn't want it anywhere near businesses or to be seen to be taking money away from businesses. And so the way it's going to be run is probably with clients who make some kind of an appointment. It's not going to look like a grocery store. So it has evolved over time to deal with a lot of those types of issues, just to say, since we've been talking about it. So hopefully I get to see it next week, the beginnings of it. So I don't know if you all are interested, but it is progressing. So.
And we can't, because we wouldn't be able to provide to meet the need. So we don't want to disappoint people. So it's mainly through people we know, and we would never be in the position where we could advertise it. So that's
in researching this, I asked the Simon community if they could tell me all the food banks in Ireland, because I wanted to try to get in touch to find out what usage was like. And they really even couldn't tell me of a great source. I think there's a website that gives some kind of information with dots all over Ireland, but it really isn't, there's not much joined up thinking, I suppose, on the whole food provision front.
Just my comment to Mary is that's exactly where we were at. So we did a really long process where everyone who was coming to one of our food banks was told this is going to change and we're going to offer an enhanced service, which is the food and access to a caseworker. And a lot of people didn't want that and went to other food banks or just dropped away. And how you describe the morning of the food bank, there's chat and there's banter. I wonder, are a lot of those people coming for other reasons? They come for the food and they take the food parcel. I wonder, do they use it? Number one, do they use it all? Or two, are they coming for the social connection? So it would be interesting to offer something different, which was conditional on working with a caseworker. People fall away, but maybe those people are older people who'd come to an older people's group or something, if it was on. Yeah. So what we're doing with the department is just 3 organisations funded to pilot this model, and we're hoping that it will roll out broader funding, that an organisation like yours could get a caseworker. Yeah. But if you want, we could have a chat. But we never said we're closing down our food, but we said we're offering an enhanced service. And some people thought, no, I'm not into that. And, I wonder, we never knew was the food being used. So that was interesting.
You'll never know.
Yeah.
You'll never know.
Yeah.
Yeah, it's assumption. You cannot stop disturbing food if you say, maybe they will not eat.
Yeah, I know.
Because we are talking about food.
Okay, we're almost out of time. Dr. James Carr there at the back has a question. We might take that. Absolutely, always the last word. We might take the last question from James Carr, if that's okay. James.
No problem. Thanks, Ona. Thanks for the contributions. Yvonne, when you were outlining what you do in this transition from the previous model to the enhanced model, as you referred to it, and the assignment of a caseworker and so on, I was reminded of around about that time in 2010 when we quote-unquote socialised the national debt. when people were restructuring loans with banks and so on, how you had to go through this process of having this sort of micromanagement of your expenditure. You know, so if you were going to get your mortgage restructured, did you have Sky Sports, for example? Did you have X, Y, and Z? You know, those kind of things. So I'm wondering how you navigate when you're having conversations with people about their expenditure, which obviously is incredibly reduced, arguably, is under a lot of pressure. How do you deal with that sensitively so you don't end up in sort of disciplining the poor for a way? And the second point is then, how do you move away from that individual model in the work that you're doing to feed this back into government, that where the problems are? So with the funding coming from Joe O'Brien, for example, what's the feedback process like there so that we can move away from this sort of model? And indeed all of them, with the sisters and others, how we can see all of these groups, you know, I suppose.
So the first bit there, in terms of the actual casework interaction with the individual, is sensitively done and is done with no deadline. So there isn't a judgment like, oh, like I see you have Netflix there, should you read that? That doesn't happen. So it is just, are you getting all the social welfare payments you're entitled to? Not everybody knows that they have entitlements or how to access them. Oh, you know, that looks very high for your energy costs, let's make a phone call. So it isn't about saying, you know, it's acknowledging that people have an amount of money that's for reasonable recreation purposes. So there isn't a judgment on that. So it's done in the ethos of love, respect and excellence, right? And then the other one is Joe O'Brien set up a food poverty network with every government department represented on it and a couple of NGOs. So we're on that. And then we're the Dublin partner, as I said, in this pilot with Midwest Simon and a group in Cork, and we feed stats back in. So it's done that way. I just kind of summarise them here, but we actually feed a set of stats back in periodically over the course of this 18-month pilot. Does that answer your question?
How long, when did it start? Sorry.
It only started about last September, and it's for 18 months. And we're hoping that they do an evaluation. It's seen as a successful way, alternative to food banks, and that wider funding comes from that. But quite likely, by the time it comes to the end, Joe O'Brien won't be in that job. So, because there'll have been an election by then. So, I mean, we're trying to come up with a kind of a macro solution, because I think what happened during COVID was an awful lot of organisations unintentionally got into food distribution because people just couldn't, well, we have to still help people, we have to justify our services, and everyone got into delivering parcels and distributing parcels, and we're just trying to come up with something that feels a bit more respectful for the people who need it, and also works with them with an end point in mind, like giving the person who needs it a sense, you know, this is where you are at this moment in time. This doesn't mean you'll never get back in the shops with your own money. You know, and that's what we want to work towards. It's as simple as that. It's as simple as, let's try and look at this situation and get you back in the shops. Some people will need to link with us for a long time because they just are in poverty, no matter how we jiggle around the arrears or the debt or whatever. But we're just asking people to stay engaged for as long as it takes. And oftentimes it gets to a point where people themselves say, you know, I think I'm okay now. Okay. I think I'm all right now. And we say, well, you know where we are for the future, so we don't close that door.
Final word to Lorraine.
Yeah, in terms of our food bank is not visible. The food bank runs, you make an application through Muslim Sisters of Era. And, you know, we look at that application and it's assessed. And then we'll ask like how many children you have, so forth and so on. And then we don't have people queuing and coming to us. We deliver. Every Friday morning, we deliver hampers out to families in need through that application. I think, you know, people stigmatise people in a queue. Yes, they do. But it's still needed. Soup runs are still very much needed. I was looking at our stats this morning. Last year in 2023, 22,500 hot meals we gave out in 2023. 22,500 hot meals. Now that's not without our bread or, other nutritious food. I'm just talking about the hot meals. And that's not talking about the sleeping bags, hats, gloves, scarves, vouchers, which we also give to families. So it's there. There is a food poverty there, and please God, we'll find a way of alleviating it.
Thanks, Lorraine. So on that note, we finish this panel. I particularly want to thank our visiting speakers this morning, Yvonne and Lorraine, both Crosscare and the Muslim Sisters of Air, are doing very, very important and necessary work. It's also been great to be able to mix the work of academic researchers with the experiences of practitioners. And I hope that it was of value to you as an audience. And thank you very much for attending. So I also want to thank Maya, Martin and Amy for their contributions to this panel. And thank you for attending. Thanks very much. Bye-bye.